focus on the process and what you love doing, and the outcome will get there. So be in the moment and love what you're doing, and, get around people who share and who are aligned in that mission, and things tend to get to the outcome as that process.
So for people listening also that are maybe familiar with the Hurt app, what is the difference in what you're doing now with Hurt Coach, and what all will it cover?
So Hurt Coach, the way this is built to be is really so, and the line that I love that really kind of explains this is, we're not just trying to strengthen or bridge the gap, we're trying to strengthen the continuum, right? And what this is meant to be is for people more long-term, kind of out of that episodic care model, to be there to support people in the health, fitness, and performance realm of things. Let's say you're a patient who had a TKA and now they're 5, 6, 7 months out, and maybe they're done with physical therapy after 6, 8 weeks, or maybe several months, but the surgeon would still like them to continue some strengthening. And, this is something that doctors can trust to build them something that's going to help them in the health fitness side of things after they've gone through that in their life. That's one example. Another example would be your ACL patient who's 9, 10 months out, who may have ran out of physical therapy, or maybe they've met all of those criteria to kind of move past physical therapy, and they might not have the resource to help them get back and play high school basketball. This is something that they can utilize and work with really experienced, knowledgeable people that will help them safely return back to sport after they've completed their care in physical therapy, where they can build things like an agility program, or how can they further expand their conditioning. And you have a lot of empowering people right now who are available that are vetted and can be trusted by doctors to help them with that process.
Thanks for tuning in to the Healthy Careers podcast. In 2024, we reached over 32,000 listeners and ranked in the top 15% of all podcasts. We're proud to have SharePro Health as a sponsor and are currently looking for 2 more partners in 2025. If you're looking to connect with healthcare leaders, providers, and innovators, we'd love to spread the word about your service, product, or business. Reach out to me, Maddie, for more details. So obviously, and this is just from my understanding, so say I'm a patient and I've, done all the PT and I have a meniscus tear and I've done all the work and I've had the surgery, and now like my PT appointments are up, and I say, okay, I want to work through Hurt Coach. So is everything highly personalized as well? Or how does that matching process go with the clinician or the provider?
Yeah, so it's going to be very injury specific, very personalized. So the way things are going to get kind of built out, and there's going to be evolutions to this as we develop and evolve, obviously, but things are going to be very specific. And, the first part of what we're going to do is we're going to sit down kind of like this, and we're going to talk to people for 45 minutes to an hour and really kind of get to know them, discover what's going on, and develop a plan for them going forward, so they feel comfortable implementing that. So yes, highly personalized and very injury specific to help them.
That's awesome. And so from a patient or a consumer standpoint, they would be able to submit a request, and then they would be matched with the best person for that injury based on the people that are in network with Hurt Coach.
Yeah, so the Hurt Coach is going to be a vetted group of people that are going to be there, and then they're going to get connected with the consumer, and then things will kind of develop and grow from there as part of the package.
Very cool. Okay. And in terms of how someone would pay for this, so is it going through insurance? Is it out of pocket? Is it based on the injury? How does that work from a patient standpoint?
It'll be a cash-based service. So, they'll go on to the website. They'll go through they'll get some information from there. There'll be some registration. They'll get to kind of pick some things. And then that's going to set a trigger off with what kind of happens behind the scenes, and then kind of connects them with someone so that they can get scheduled and go through this process.
That is super cool. That's something that I'm going to have to look into, because my biggest problem with PT is finding time in the middle of the day to actually get myself to go. But I do a lot of my stretches for just, not only my own injuries, but trying to prevent other injuries. at home at night. And so if I had something that I could do, remotely, I would assume that you're doing these appointments as well.
Well, yeah, the way that it's going to initially kind of drive is the person's going to connect with the coach. The coach is going to go through a pretty in-depth call with them to do some discovery and some development from there. Then they're going to create a plan for them. They're going to then deliver the plan to the person. And then there's going to be kind of 2 follow-ups afterwards with some kind of resources to connect them throughout the time frame. Then we're going to check in, see how things are going, see what needs modified, and we're going to do that again. And that's going to be kind of the basic premise of the initial product. And I think, there's going to be a lot of additional things that will occur, whether it's video-based or audio-based. Hey, I need help with this. What can I do with this? Those types of things will become available as we evolve.
Very nice. Okay. And in terms of the coaches, is that going to be kind of a broad range of like PTs, OTs, ATs, like who all, when you say like selected qualified coaches, where are you finding those folks?
So it's people like me that have a kind of health, fitness, coaching background. There's, physical therapists. We have, chiropractors, PTAs, kind of the spectrum of those people. And then what I did is I developed a certification process, right? So the way that this is going to occur is people are going to have to go through the certification process, which is then going to vet them into the network. And then that's going to then make them part of the system. So, we want the best of the best to be part of this process. And that's really who we're looking for, that are going to bring that level of experience that doctors can trust so that we can do these types of things with patients.
That is awesome. I'm excited for you guys. I'm so excited to see how it rolls out. And so when can people anticipate this going live, or has it already gone live?
So we're going